Hi, I'm Jeff Matan, President of Good Samaritan Hospital, a proud member of MedStar Health, where we've been serving the healthcare needs of the Baltimore community for more than 40 years. Thanks to the generosity of donors to the Good Samaritan Hospital Foundation, we've been able to take that care to a higher level. Since 2001, we completed the expansion of the Harry and Jeanette Weinberg Emergency Department and our outpatient rehabilitation program. We purchased our linear accelerator for cancer treatment. We opened 2 new patient care units, as well as our new and improved Good Health Center, upgraded our operating room, and more, all because of philanthropic support. Recently, Good Samaritan Hospital was recognized as one of America's best hospitals for 2009 by U.S. News & World Report in the areas of orthopedics and diabetes and endocrine disorders. But as proud as I am to tell you about the growth of our facility and the accolades we've received, the real story of the impact Good Samaritan Hospital has is in the lives we've changed through our service to the community. I want to share just one story with you that puts into a personal context how funds received by our foundation can drastically improve the lives of people who perhaps need our help the most. I'm talking about burn victims. You may be surprised to learn that burn injuries are second only to motor vehicle accidents as a leading cause of accidental death in the U.S. But as difficult as the tragedy of a loss of a life is to bear, the challenges faced by individuals who survive serious burn injuries are often much more painful, physically, emotionally, and spiritually. These special challenges, combined with the medical advances that make it possible to make such dramatic improvements in a burn victim's quality of life, are a few of the reasons why we established the National Burn Reconstruction Center here at Good Samaritan Hospital, and why we are so proud to have recently brought on one of the most renowned burn reconstruction surgeons in the world as our medical director, Dr. Robert Spence. Trained in general surgery, plastic surgery, and burn treatment, Dr. Spence has been a pioneer in developing skin banking concepts and innovative surgical techniques. Over the past 25 years, he has helped hundreds of children and adults injured by fire, as well as soldiers who have been burned in bombing attacks in Iraq and Afghanistan. Today, I'm pleased to introduce the man who is making an extraordinary difference in the lives of the many people who seek help at the Burn Reconstruction Center at Good Samaritan each year, Dr. Robert Spence.
Thank you, Jeff. I'm proud to lead our team of experts at the National Burn Reconstruction Center here at Good Samaritan Hospital. Professionals who are dedicated to providing patients with every opportunity to heal, inside and out, and regain their quality of life. That's especially important when it comes to children. It's estimated that there are approximately 10,000 pediatric burn injuries annually in the United States. And many of these children come from economically disadvantaged families. According to the American Burn Association, 31% of all burn victims are uninsured or underinsured. In 1994, one of my patients, an extraordinary 6-year-old boy named Paul Terrell, was one of them. The fire started on a cold January night when Paul, his mother, and 6 brothers and sisters were fast asleep. A pile of clothes draped on a hot furnace grate caught fire, and when the blaze was finally extinguished, Paul's mother and all of his brothers and sisters had perished. Amazingly, Paul, who was sleeping between 2 of his siblings, survived, but suffered 2nd and 3rd degree burns on 27% of his body, primarily his hands and face. One of the most terrible things about a burn injury to the face is that it deprives the victim of their normal connection to humanity. The people with badly scarred faces often suffer the heartbreak of being completely shunned by anyone outside of their circle of family and close friends. Restoring that connection is one of the things I hope to do for Paul as we embarked on a journey that would include 9 operations over the course of 10 years. Although he was a difficult case, Paul did have one advantage. He had no burn injuries on his shoulders, so we were able to use tissue expansion techniques, basically inserting a balloon under the skin of his shoulder, then slowly filling it with saline solution over the course of several months. After 3 months of expansion, we were able to use the extra skin that had grown to accommodate the expanded balloon. We were then ready to begin the long process of resurfacing Paul's entire face. Over time, we were able to remove all of the scars and repair his chin and nose. The success of such extensive reconstructive surgery is not judged by the standard of perfection, rather by the standard of what is as normal as possible. And by that standard, I think we've succeeded with Paul.
Thank you, Dr. Spence. Hello, I'm Paul Terrell. Dr. Spence has already told you about the medical part of my procedure, and I'd like to go ahead and talk to you about what I think is important, the difference he made in my life. Even more important than giving me back the use of my hands and smoothing out the skin on my face was the relationship I developed with Dr. Spence. No matter how complicated the surgery was going to be, he'd walk me through it step by step in a way that I could understand, even as a little kid. I feel he helped rebuild my spirit as well as my body. And with his support and encouragement, I was even able to convince my grandmother to let me go to burn camp, where I got to feel even more like a regular kid. Today I'm doing great and enjoying life. I'm studying video production and plan on becoming a writer and producer. Dr. Spence did more than give me back the use of my hands and face. He gave me back my hopes and dreams for the future.
Restoring the hopes and dreams of people like Paul is truly what Good Samaritan Hospital is all about. It is only through the generosity of our donor community that we can offer the kind of important care that the Burn Center and the other vital foundation-supported services provide, such as uncompensated emergency room care, health screenings and assessments, community wellness programs, and medical education and training, just to name a few. Without the support of people like you, we wouldn't have physicians like Dr. Spence, who make the journey from hurt to healing to hope possible. Thank you for listening, and most importantly, for caring.